Have you ever noticed a faint pink or reddish mark on the forehead of a newborn, almost like a delicate brush of color from an unseen hand? Some parents call it a kiss from an angel. We in medicine call it something else, but we know the truth is less mystical and more anatomical. Angel's kiss, also known as salmon patch or stork bites, or in medical terminology it's called Nevus simplex, are common vascular birthmarks which happens in about 30 to 50% of newborns. It is caused by clusters of dilated blood vessels or capillaries near the skin surface. This stork has long been a symbol of childbirth in European traditions, depicted as carrying newborns enclosed held in their beaks. The bite or mark on the nape of the neck was said to result from this imagined act, because nape of the neck is the most common site of these marks. These marks are flat, pink, red or sometimes purplish in color, with feather-like border as you can see in this picture. It may darken when baby cries or strains because crying or straining causes increased blood pressure and heart rate, which causes more blood rush through the superficial vessels, especially near the neck and face. That is why it makes the marks darker. The main reason of these red patches results from incomplete contraction of blood vessels during development, so the tiny vessel in the skin become visible. The common location of these marks are all on the face, especially central forehead, eyelids, between the eyebrows, which is called glabella, nose bridge, and sometimes upper lid. Nevus simplex should not be confused with a port wine stain, or a type of capillary malformation, which is a permanent lesion and may be associated with Sturge-Weber syndrome. Nevus simplex is usually symmetric, with lesions on both eyelids or on both sides of midline. Port wine stains are often larger and unilateral, and they usually end along the midline. Most of these marks fade on their way naturally with no specific treatment. Actually, the marks on the face will usually fade after 1 or 2 years, but those marks on neck may sometimes remain forever. They are completely harmless and not associated with any underlying issues. For persistent cases, though it's really rare, the doctor may use laser therapy to remove it. And sometimes if the mark is accompanied by more symptoms like swelling, texture changing, or other symptoms like seizure, the baby should be examined by a doctor as soon as possible.